In this video, we look at black period blood, what it means, if it's normal, and when one has to really get in touch with a doctor. During a menstrual cycle, the uterus lining thickens to prepare the uterus for the potentiality of getting pregnant. When pregnancy is not achieved, these unfertilized eggs perish and are discarded. Menstruation removes all dead materials from a woman's body. Vaginal discharge is usual for women during menstruation. Mucus production peaks during the commencement of a woman's period. These discharges are usually colorless. Some women have dark or black menstrual blood at the end of their menstrual period. This is a normal thing to happen, and one shouldn't worry much. Brown or dark discharge can be due to remnants of old endometrial tissues. This happens when the uterus is cleaning out old tissues and changing into newer ones. Black blood is generally old blood that wasn't evacuated from the body quickly enough and was exposed to air or oxygen, thus the change in color.
Common suspected reasons of blood discoloration are stress and depression. Stress and depression can cause the uterine lining to thin out, which may delay shedding of the endometrial wall. This delay causes blood period to be oxidized and change its color.
Blood clotting. Blood clots are usually characterized by black period blood discharge. Once the clot subsides, the blood color will return to normal. Blood clotting may also occur after miscarriages.
Birth control pills and steroids can darken blood.
Changes in blood color may indicate internal organ injury. Some brown or black discharges may be caused by erosion, rupture of a cyst in the uterus, or injury in the surface and mouth of the uterus.
Other causes include yeast infection, PID or pelvic inflammatory disease, cervical cancer, bacterial vaginosis, and STD or sexually transmitted diseases. Dark blood can also be an indication of the beginning of menopausal period or premenopausal stage. Or it can also be a sign of pregnancy.
Implantation bleeding happens when a fertilized egg sticks to the inner lining of your uterus. This usually happens within 2 weeks of getting pregnant. Most of the time, this bleeding lasts less than 3 days, and you might think it's just spotting. Most of the time, this blood will be anything from dark brown to light pink, but if it is very dark brown, it could look black. Generally, black period blood is noticed at the beginning and end of the period. Blood oxidation causes the color change, which is normal if it is low volume and lasts a few days. If you have a heavy flow of dark red or almost black blood lasting beyond a week, along with pain, nausea, dizziness, fever, skin itching, vaginal dryness, foul odor of discharge, pain during sex, mood swings, loss of appetite, vaginal bleeding between periods, etc., then seek medical attention quickly.